Welcome to the presentation on Achilles tendon taping. This is generally done for tendonitis. So the Achilles tendon is a different structure than we've taped so far. When we were taping the ankle joint, we're taping a bony structure and we're wanting to restrict the movement. This is a structure that moves. It's this tendon at the back of the lower leg, connects the calf muscle down to the heel bone. And we want it to move. We just want to support its movement. So that means we're going to use elastic tape. We want to help it do its job without restricting its movement. We are going to still use that 90-degree of flexion position. And with this tape job, you really do want a patient lying on their stomach, on a table or a bed, and you want the table or bed to end right around, just below the knee. That's going to give you access to the whole lower leg. So we are going to start with pro wrap, wrapping it from the middle of the calf all the way down around the heel to the foot. And then we're going to apply our anchors. The foot anchor is just like the one we did with the ankle tape job. So you're coming around the bottom of the foot and back up. And you're looking to be at the end of the arch so that you're down where that fifth metatarsal, the bump on the bone on the side of the foot, is sticking out. The anchors on the leg need to be at mid-calf or above mid-calf. As you can see from this picture, once you pass that position, all of the muscle moves downwards. So if we had our anchors down in this position, when the patient stands up, they're probably going to fall down the leg. So it's really important here that the top anchor is on the skin, and you want the patient to also contract their calf muscle. So it's easy enough to have them push their foot down here into your leg. That will contract the calf muscle. Then you make sure that you don't apply these anchors too tight. So you're going to start at the front on the shin, come around behind, back out to the front and rip, and then a second one overlapping by half, just like we did with the ankle tape job. Now we're going to use the elastic tape. So you're going to start at the foot anchor. You're going to attach the tape there. You want to stretch it out so it's fully taut, then release a little bit, and then run it up the back of the leg and rip at the top. You generally want to take about 50% of the stretch out of the tape. You're going to do at least 2 or 3 strips of tape. Remember, more tape restricts more, provides more support. Less tape does less. The last piece is that you're going to reapply the anchors we did before. 1 on the foot, 2 on the leg, and again, this isn't with the elastic tape, this is with the white tape. Now I'm going to walk you through the process. So we have the person's leg hanging off the table with the foot in 90 degrees. We use the pro wrap to protect the skin. Remember, pro wrap can wrap consistently around the leg. You don't need to rip it as it comes around the leg. Now we'll be using the white tape, and we're going to do the anchors. So the first one is the anchor on the foot, and remember, we're hitting that point on the outside of the foot. And then we have the 2 anchors on the leg. So you'll notice that the foot is pushing up into the taper's stomach, so you're getting that calf muscle, overlapping by half. But it's still not done really tight. There's some looseness in that tape. Now you move to the elastic tape. Apply it to the anchor, stretch, relax about halfway. You can run that down the leg. There'll be 2 done here. Again, pull it all the way taut, relax, and about 50%. And then you use the white tape again to reapply your anchors. So one on the foot, again having the patient push into the stomach so that you actually have some tension in that calf muscle. And making sure your anchors on the leg aren't too tight. 2 or 3 anchors as long as you actually have everything secured. So other indications for this tape job, you might have somebody come in who doesn't have all of their pain on the back of their leg. They might have it to the tendons on the outside or the inside of the ankle. Okay? You can do the exact same tape job, put one strip up the back of the leg and then 1 or 2 to whichever side is causing a problem. Okay? That will help support those tendons as well. So still same process, you're just moving 1 or 2 of the strips of tape to the outside. Now, important notes, if the tape is getting too tight, this person's going to feel like they're getting a calf cramp. Okay? So either you've put too many strips of tape on, you haven't let some of the tension out of the tape, or your anchors on the calf are too tight. So those are all things to adjust. Remember, as with all of our tape jobs, the more strips of tape you use, the more support. The other piece that comes into play with elastic tape is it's also how taut you pull the tape. So if you have more of the tension out of the tape, then it's going to be tighter. And again, remember that your tape is removed after activity. They probably need to do some stretching for the Achilles, possibly some icing, and we never sleep with tape on. That's the time for the body to relax. So up next is knee wrapping and taping, followed by hip wrapping and taping. And remember, for more information on healthy living or to see my other courses, please check out thehealingpath.com.